अस्सलाम वेलकम टू फिजियोथेरेपी चैनल। आज का हमारा टॉपिक है स्ट्रेंथ एंड कंडीशनिंग स्पोर्ट्स फिजिकल थेरेपी का इंट्रोडक्शन। टू enables the appropriate development of rehabilitation programs, sports rehabilitators requires a comprehensive understanding of strength and conditioning principles and practices. Appropriate conditioning is essential to optimize performance and to reduce the risk of injury. Training for the strength. Training methods: heavy resistance training, plyometrics, complex training, assisted and resisted training, explosive isometrics, eccentric training, and Olympic style lifting. हम देखेंगे explosive force production क्या है. Few sports rely exclusively on maximal strength. Of these, the most notable sport that does rely on strength is powerlifting. Other sports' explosive force production are power, which in turn depend on both the magnitude of force produced, जो कि strength है हमारे पास, and the rate at which it is applied speed. Of these, it is often the rate of force development that is more important to sporting success than the magnitude of the force developed. Sporting movement occur quickly, often between 30 and 200 milliseconds. The length of the contact time during maximal sprinting is between 70 and 125 milliseconds. Prior to competition, training should focus on maximizing the force that can be developed quickly, increasing the rate of force development. The quicker a sprinter can generate force, then the faster they will be. Training to maximize rate of force development. Rate of force development is best enhanced where training explosive movement, where the intention is to accelerate the resistance, either a bar, medicine bar, or the body, as quickly as possible. Slow, heavy exercises increase strength and therefore the maximum force athletes can produce, but don't increase the force development within the first 200 milliseconds of the contraction. Short response training, reactivity training. Short response training is also called reactivity training, that is specifically designed to help athletes accept and produce forces over very short period, typically 70 to 200 milliseconds. Plyometric training involves very quick, light yet powerful activities like quick feet, skips, and low magnitude jumps. Plyometric can be effectively performed in water, beneficial effect on tendon and joint stiffness. Long response training. Long response training refers to the training of powerful explosive movements with a contact or application time of more than 200 milliseconds, characterized by greater amplitude of movement about the hip, knee, and ankle joints, and also by the use of a greater external resistance. Include activities ranging in speed from faster activities of around 200 milliseconds, which include bounding, tire pulling, single leg hopping, and depth jumping, to longer activities of up to 500 milliseconds. 500 millisecond activities include unweighted squats jumping, one legged jump squats, and weighted jump squats. Tire lifting and depth jumping. Isometric training increase in rate of force development, power, and vertical jump height, which is attributed to increase in tendon stiffness. Should not be the sole method of training. It is generally incorporated into normal training session as a few additional sets. Intensity, load on y-axis, and time duration on x-axis. Graph is showing fluctuating overloading. Second graph, same load on vertical axis and time duration on horizontal axis. In this graph, we can see progressive overloading. Progressive overloading reality. सेम ग्राफ, लेकिन मैक्सिमम लोडिंग पे जाके हम कांस्टेंट हो जाते हैं. एक लिमिट तक हम ओवरलोडिंग कर सकते हैं, उसके बाद कांस्टेंट. Overload and super compensation. Super compensation is also called adaptation. For adaptation to occur, the training stimulus must be at a level beyond that normally encountered. Training at a level or intensity that is beyond that normally encountered is called overload. And it is this overload that stimulates the adaptations that allow the athlete to tolerate an increased level of training stress. Training causes physiological, biochemical, and mechanical stresses. Once pre-exercise levels have been restored, recovery is still not complete. The body continues to adapt, rebuilding and remodeling itself until a higher state of readiness is reached. For a short period of time, an athlete's fitness is enhanced. This is known as supercompensation, which is also called adaptation. Time period during which supercompensation occurs provide a window of opportunity during which the athlete should train again. If the athlete trains during this period of supercompensation, the cycle is repeated and fitness continues to improve. Timing. The timing of the next training session is vital and varies according to recovery abilities of athletes and the demand imposed by the previous session. For example, a well conditioned athlete can recover from a long training run within 24 hours, excluding skeletal system, whereas the same athlete may take 10 days to recover from a heavy resistance training session involving rapid eccentric activities and supramaximal loads. Training parameters. The training parameters that contribute towards overall training effect include frequency, intensity, and duration of training sessions, the quality and quantity of rest between and during sessions, and specificity. Each of these parameters can be combined and manipulated within a training program to elicit the desired training effect, which is called specificity. Now, the term is detraining. All improvement in the fitness are reversible. What an athlete can gain with training, they can lose with detraining. When athlete stops or reduce their training, their body system adjusts accordingly. This presents as a loss of strength and power, decrease in maximal aerobic capacity, and loss of coordination. To minimize fitness losses, injured athlete must examine strategies within their treatment and rehabilitation, which enables them to continue to exercise. One such strategy may involve the use of alternative low risk activities that do not stress the injury. Specificity. The principle of specificity dictates that training should match the demand of the sport. Given that sport consists of many components with successful athletes needing to start, stop, twist, turn, run, jump, land, shuffle, push, pull, hit, bend, throw, catch, hop, accelerate, deaccelerate, all within the fluid, dynamic, and unpredictable environment of sports, and all without getting injured, we are presented with a complex problem. Program's designer must analyze the demand of the sport. Second, identify the sports characteristics of the athlete, which includes strength and weakness, training history. Third thing is tailor and prioritize training to allow each individual athlete to meet these specific demands. No muscle works in isolation. The training methods that transfer best to actual sporting performance usually involve coordinated movements across multiple joints rather than strict isolated exercises. Train movement, not just muscles. Sports specific movements are also enhanced by training at greater speeds in multiple directions and under varied and unpredictable conditions to challenge an athlete's balance and proprioception, enhancing their ability to stabilize joints and maintain posture, allowing the transfer of forces efficiently from one body section to another. Injury prevention, avoidable versus unavoidable injuries. Unavoidable injuries, in situation where a high velocity, high energy collision coincides with a vulnerable joint position, injury is usually unavoidable. Under such circumstances, vulnerable joint positions, high velocity, high energy collisions, there is little that can be done to condition against injury. What are avoidable injuries? If an injury occurs during the performance of a common sporting task, twisting away from an opponent, landing from a jump, sprinting for a bar, then it is likely that appropriate conditioning could have either prevented the injury or lessened its severity. If the muscles are activated in an efficient and coordinated manner, they can brace the joint under the condition of dynamic load, such as those encountered during sports, and help prevent injuries otherwise attributable to weakness or laxity of ligaments. Appropriate conditioning involving strength, agility, endurance, force acceptance, control, technique, proprioception, and reactive neuromuscular component is crucial to both the prevention and rehabilitation of the injuries. Functional explosive strength, which include maximal strength, rate of eccentric force development, short response strength, high velocity strength, coordination and skill, long response strength, rate of concentric force development. Traditional rehabilitation focuses on the restoration of mobility, strength, and endurance, allowing progress to be monitored via number of simple tests including isokinetic assessment, range of motion assessment, and measures of aerobic fitness. Functional rehabilitation bridges the gap between traditional rehabilitation and functional demand of sports via sequential progression of ever more challenging and specific exercises. Programs, coaches, and rehabilitators must never lose sight of the specific demand imposed by the sports, including the ability to exhibit rapid and coordinated responses to ever changing environments. Any question? Thank you.